So first question, what injuries can occur while running, both long and short term? Well, kind of a loaded question because there are several injuries that can occur. A lot of it kind of comes from the ability of the athlete or the patient to gradually increase their loading, increasing their running mileage. So a lot of times, for example, we might see a patient who comes in with knee pain who's training for a marathon. Now, how did they get up to their training? Have they been training for months now and this is just something that's been nagging ongoing? Or is it something more recent because of a big spike in running mileage? They haven't run in 2 years and suddenly they're not running 3 miles 4 days a week. So that's more kind of in the short term, or some things that can creep up knee pain or hip pain. The longer term stuff is more chronic in nature, and that actually can result in some sort of like a stress related injury in the bone. In this case, we think of the hip, or down the shins, we call them shin splints, which I'm sure you've heard of before. And a lot of that has to do with a loading and overloading over a long period of time that inflames the tissue around those joints. So in the short term, you have kind of like aches and pains like knee pain or back pain or hip pain as your body adjusts to the incident, assuming you don't have an ankle sprain. Like if you're running on trails and you sprain your ankle, that's more of a shorter term injury that can be easily managed. The stuff that has a longer term rehab associated with it are kind of wear and tear type injuries that eventually the bone breaks or the body just starts to wear down because it's not given enough time to recover between workouts, or it's just too much too soon. So those are kind of the two different type injuries that you can encounter while running. Second question, running experiences an injury and then return on at the level they were at before the injury, would there be lingering side effects? Good question. Again, that depends on the type of injury. So for example, let's go back to the short long-term example. So if you have an ankle sprain, that is something that certainly with the appropriate rehab program or rest, recovery, strengthening, that runner can get back to. In this case, I'm assuming a long distance runner can get back to running that type of mileage and tolerating it pretty well. A sprinter would be a little bit different because there are different energy system demands, different muscle fibers that are recruited in that activity as opposed to something that's more long distance. So a sprinter would be a different example. But if the injury was something that's stress related, that's going to require a bit of time of deloading or even decreasing the running type activity so that they can let the bone heal, whatever is inflamed or involved, aggravated, giving that time to just calm down so then they can gradually ramp up their mileage. Certainly if it's an injury that requires surgery, that's going to require even more time. If it's a wear and tear type thing in the older population, like something within the hip that requires some sort of resurfacing procedure or reconstruction, they may not get back to being able to run the mileage they did before. I guess it's always relative, right? If you have someone that likes to run 5Ks, that goal may be more easily attainable even after a surgical procedure, depending on what's done, than someone who has been used to running ultra marathons and stuff, right? There's a lot more that's required to build up to that level of running and conditioning. So it can vary, it totally varies. I know that's kind of a vague response, but it will totally vary on the age of the individual, the structures involved, and the type of injury that it is, whether it's short or long term. So,
thank you.
What are the worst injuries a runner can experience? Why? A runner will probably tell you any injury that prevents them from running every day, all day. But no, in seriousness, I think the ones that we encounter the most are related to the knee joint and the shins, because those sometimes are tricky. A lot of times when they present to you, it might be more acute, and there might be symptoms all around the knee. So it's figuring out, is there a movement predisposition that is causing them to develop this pain? Is it increased mileage? Did they go from running flat terrain to now they've moved to Clemson University and running hills and running trails? Like all those things factor in. But as a result of that, it's sometimes hard initially to pinpoint what exactly is going on. So anything knee related could take a little bit more time than expected, or it could be something that could respond really well initially, and then you can gradually ramp them up. The worst injury in a runner, assuming they haven't injured a knee ligament or sprained their ankle that bad, or had a fracture if they're on a trail, had a bad enough fracture falling and tripping, Probably shin splints, because it requires so much more time for them to cut back on their running activity and adapt using other types of aerobic type activities, biking or swimming, and for a runner, they just want to run all the time, so that can create an issue. Those are probably the two worst. In the knee, it could be any sort of thing. It could actually involve the meniscus. If it's a lot of repeated loading or hill running, that can aggravate the meniscus and lend itself to an issue which may or may not require surgery. And then the other one would be more the shin splints, just because it requires a little bit more time of rest and recovery and deloading that tissue so that it can heal up.
Where would you put tearing your ACL on that ranking?
ACL would be pretty high. Now, isolated running injury doesn't happen as often. I mean, it's rare that you come across that. But usually the injury occurs in a sport where there's a lot of twisting and cutting. So for example, you run in soccer, but because of the quick cutting and change of direction, soccer, basketball, lacrosse, that injury is more common. So tearing your ACL in a sport that has those type demands, that's going to require you a little bit more time of healing to get back to that sport, which requires running, and running is actually a step in the rehab process that you would get to. That's where Alter G comes in really helpful, because we can unload the body weight a little bit and allow them to gradually adapt to the point where they're full body weight running. So in terms of a running isolated injury, it's very rare to come across. It's more stress overuse type related injuries. But in terms of other sports that involve running, the ACL injury risk might be higher, and running is going to be a milestone in their rehab that we get to before they get back into their sport.
Thank you.
So, exercises runners use in rehab to return from an injury. Why are those exercises used? I'll give you a good handout that actually explains that.
Yeah.
Supported by research evidence, why we focus on specific muscles. But from my experience, a lot of the conditions that I see from runners when they do come in are biomechanical in nature, meaning there are certain movement dispositions that they have in terms of loading. Some people may have really flat feet where their arch collapses when they run, and that can lead to issues up to the knees and the shins, or in addition, the muscles around their thigh and their hip to absorb that force when their foot hits the ground, and train that pattern over and over.
All right.
So those are some of the exercises. Running injuries, closing comments. I would say if you are a fairly seasoned runner and you are thinking of doing a longer distance run or getting into competitive running, you want to be able to complement your running program with a good strength and conditioning program. The amount of mileage that you're going to get is going to put enough stress and wear and tear on your body, but you want to make sure that you fundamentally are strong enough to take on those loads. So mixing in days of the running, which is impact loading through your joints, and days where you do more weight training, non-impact type stuff with some sort of alternative cardio, can definitely go a long ways in terms of being able to gradually build up and optimize your fitness. So it's all about sometimes working smarter, not harder. And in this case, it definitely applies to running to avoid some of the injuries we talked about before that are more stress overuse related.